There are very different political strategies around the world. Some are more autocratic, some are influenced very much by democratic decision-making processes. You can see that heads of state and government take very different approaches. Some of them are very, very involved in the response, like the Prime Minister of New Zealand or the Chancellor of Germany. Others are not that interested in the COVID crises as the President of the United States. So you see very clearly that governments are taking a different approach. And of course, it also depends whether the decisions that are necessary can be taken at the level of the central government or whether it needs the involvement of decentralized states. And that has been a complexity in many Western democracies. Well, what we find and what I think the WHO has also indicated, one relaxed too quickly. One felt safe when the numbers really went down during summer. One, of course, also was nervous about the population not accepting further restrictions during the summer, like travel restrictions. And in most cases, or in many cases, Western governments in Europe responded too late. They underestimated the virus. No, definitely not, because the World Health Organization called a public health emergency of international concern at the end of January, but and many of the Asian countries acted straight away. Some of them closer to China acted even earlier because they had had the experiences of SARS, for example, and so they put measures that they had introduced during the SARS pandemic also into place straight away. So we can see some countries reacted very, very early. Most of the countries in Western Europe only started acting seriously towards mid-March, end of March. And that proved to be one of the reasons why Europe faced such a big first wave. Europe definitely responded too late. You see, there was also a feeling, if you go back to previous outbreaks and pandemics like SARS, like Ebola, they never really hit Europe. And to some extent, I think the European mind frame was, well, this will pass us by as well. It's an Asian virus, it's there somewhere. And therefore, one applied a bit of magical thinking and did not act soon enough. And so it needed the pictures from Italy, for example, to really get Europe and also the European Union to wake up and to say, we do have to act and we have to act quickly. The pandemic is not a legal mechanism in the World Health Organization. The legal mechanism in the international health regulations is for the Director General, on advice of a committee, to call a global health emergency of a public health emergency of international concern, a FIC. And this is what the WHO did. It's very interesting that the WHO doesn't call a pandemic and say it's now a pandemic, you all have to act. It calls a public health emergency, and that means everyone has to act, everyone has to be prepared. A pandemic happens when it's everywhere or nearly everywhere in the world. When WHO called a public health emergency, it was only in a couple of countries, but it called the emergency because it wanted to avoid that it spread all over the world. But it was not successful because, quite honestly, I don't think many countries knew what a public health emergency of international concern was. The public health officials did, but not the heads of government. It is the countries themselves in WHO, 194 member states, that agree on a common strategy. And they had agreed about 15 years ago on the international health regulations. They clearly say how countries should prepare. They say how countries should notify the WHO if there is something atypical, and they give indications for first responses. No country is like the other, but a range of public health preparedness measures and response measures are very, very similar. And so, of course, the WHO will try and give those recommendations and guidelines. And already in January and February, it issued a whole range of guidelines for countries. And countries can then adapt those guidelines to their specific situations. You know, in urban situations, for example, if you have a lot of older people in Africa, that would not be the case. So that is the way that the WHO would act and try to act on scientific evidence. We have an enormous spread in practically all countries of the world. We have different death rates in different countries of the world because it depends on the demographic composition of countries. You know, people have been asking, why are there less deaths in Africa, for example? But we have incredibly high infection rates. We have second and third waves that are happening. And the nervousness is very great. The nervousness is also very great because some of the countries that in the past would help with establishing a global response, like the United States of America, is at present not acting as part of the global health community. And so this is very disconcerting. We see also that countries are working together more on continents and between continents. We've seen that the African countries are working very closely together in the African Union. You just heard over the last few days how the European Union is moving towards a greater interaction between their member states, and WHO, together with other organizations, has established some solidarity mechanisms like the ACT-A accelerator for diagnostics, vaccines, and therapeutics, but in particular the COVAX, which aims to bring countries together to actually share the distribution of vaccines when they become available more equitably around the world. Right now, we have, a range of NGOs that are actually building on many other health programs, because we see, particularly in Africa, that the infrastructure that was put in place for polio eradication is being used for tracking and tracing. The same is true for the system that was established to track down Ebola. And of course, many NGOs on the ground are helping there. There is also, of course, the support to the health systems so that people can be treated. And of course, we mustn't forget the very, very big amount of voluntary workers. For example, the International Federation of the Red Cross and the Red Crescent is playing an incredibly important role on the ground, as it did with all other outbreaks. So in many cases, particularly where health systems are weak, NGOs play an incredibly important role, but also in our part of the world, because, the support to older people, particularly in the context of lockdowns and difficult situations, has partly been balanced by a lot of voluntary organizations. And then, of course, the advocacy and the democratic component that NGOs bring is absolutely critical. There's been so much inequality in the context of this pandemic in all parts of the world. Many people say, COVID-19 shone a light on existing inequalities. And it's been very, very important that civil society organizations draw attention to this. What happens, to disadvantaged groups, what's happening to women, what's happening to children. So their role is both in service provision, in helping track and trace, but also particularly in shining a light on the most vulnerable.